Thank you, everyone. Welcome, families, to today's Parent University. We are excited to continue the conversation we started last week. Last week, we started the conversation around student substance use and prevention. Last week, we had a panel specifically made of DCPS teams that do this work. And today will be we'll have guests from Children's National Hospital and the Department of Behavioral Health with us, and they'll introduce themselves briefly. If you're interested in seeing more about the DCPS-focused Parent University, we have recordings of those, and the links are in the chat. Today's conversation will be focused on general youth health, general substance use prevention for children and adolescents, and we'll focus on city resources and supports. Alrighty, so let's go ahead and get started. I will do a brief announcement in Spanish to make sure our families who need interpretation can access this interpretation. Buenas noches, familias. Hoy tenemos una sesión de padres que es enfocada en la salud de los estudiantes en general y recursos de la ciudad. El enfoque acerca de la prevención del uso de sustancias enfocada en DCPS fue la semana pasada y eso es en los links que vieron ahí en el chat. Si usted necesita interpretación en español, usted puede accesarlo de esa manera. Aquí tiene cómo accesarlo si están usando una computadora. Y si usted está usando un dispositivo móvil o una tableta, lo puede utilizar de esta manera. De cualquier forma, yo voy a poner esas indicaciones en el chat por si usted necesita cualquier cosa. Y lo voy a estar poniendo durante la presentación. Okay. Excellent. Families, in today's session, we will also use the Q&A feature in Zoom to make sure that you get answers to your questions. To use this feature, you select the Q&A icon in your Zoom window. It looks like this. Once you click on it, you will see a box like this pop up, and you can type in your question and hit send. You can hit send anonymously or send your name, and it will show up here. Not all questions will show up right away. We'll make sure to answer as many as possible. We have several folks in the team to answer those questions. But again, if you have any questions at any point during this presentation, this is the way to send your questions. Okay, continuing on. Before we welcome our guests today, I just want to make sure we touch base on a couple of community norms that we have here. The first one is assume best intentions. We are all here because we care about your children, and we see you as partners in this work. So as we go through this work, please assume best intentions. We want what's best for all children. Please go hard on ideas, not on people. The only way we can improve is by hearing your feedback, by you sharing feedback with us, by pushing us to do better. And so we really want your thoughts on ideas and go hard on those, but please go soft on people. And finally, accept non-closure. We try to offer as much information as we can. We're going to cover a lot. And if you still have questions at the end, there are many ways to get in contact with us to continue this conversation. And there are a lot of resources out there we're happy to connect you to. So please accept non-closure because you might walk away with even more questions to ask. All right, so what today's session is going to look like. We're going to have our guests introduce themselves. Then we'll talk about resources and supports that that are available in the community to our DCPS families and children to keep them safe from substance use. Then we'll have a space for questions and answers. We have several families who sent questions in advance through our registration link. And we also have questions that will come in through the Q&A chat, through the Q&A feature in Zoom. So we'll go through those. And then we'll close out with the most impactful action that you can take as a family member and a caregiver. All right, so without further ado, we're going to introduce Dr. Kaliamurthy and Eric Chapman. Dr. Kaliamurthy, if you want to introduce yourself.
Hello, everyone. A very good evening. Thanks for joining. I imagine it must be dinner time or bedtime in some of your homes. So I appreciate the efforts that you have made to be here tonight. So I am Siva Kaliamurthy. I'm a child and adolescent addiction psychiatrist. So I specifically specialized in trying to help kids who struggle with co-occurring mental health and substance use related conditions. I have a joint position between Children's National Hospital and Howard University. At Children's, I'm the director of the addiction clinic, where we try to tailor treatment for any substance-related concerns that are, in a developmentally appropriate manner. And at Howard, I happen to oversee a lot of the mental health care and addiction-related care. It's good to be here.
Good afternoon, everyone. Good evening, everyone. Eric Chapman with the DC Department of Behavioral Health. I am the Substance Use Disorders Branch Chief. We have oversight for substance use disorder prevention, youth treatment, and recovery. I'm excited to be here this evening, excited even more to kind of talk about certain questions that have arisen, and equally excited to be presenting with my brother, if you will, Siva, Dr. Kaliamurthy, who we co-presented 5 or 6 times at this point. So really excited about the opportunity to kind of share about the resources that are available, and certainly share that with you all this evening. Thank you.
Thank you. Thank you both for being here. All right, so let's get right into it. So a question that a lot of families have is, how does substance use look like at different stages, at different ages? So let's get started with that question.
So, when we think of substance use, it can essentially happen at any age. But, the first, in terms of data, when we look at it, most kids who really struggle, they have an early initiation, right? They start early, and by late adolescence, a significant number of teens have already experimented with drugs and alcohol. And we know that the earlier you use or you start experimenting, the more likely that you're going to develop an addiction later in life. And we tend to think about kids there's different ways to think about kids developmentally and how things look differently. For example, we think of how things are in pre-K, in elementary school, in middle school, and in high school. What I mean by that is we don't really expect kids to be vaping or using cannabis quite early on in elementary school, but they've already been exposed to substances through the community, through someone in the family maybe, or what they watch on media. So they already start having questions about what is this thing that adults tend to do, or older siblings might tend to do. And there's also questions around prescription medications in the household, especially if they're colorful prescription medications. So these are things that we want to be mindful about and start having conversations early on with kids. And it's never too early to start having these conversations. The question rather is, how do we have it in a developmentally appropriate manner? Another risk when you think of adolescent substance use or any pediatric substance use is that the brain is still developing, and most of us know that the brain has a robust phase of development that goes on to almost up to age 26. So things that we do early on when the brain is still developing, I often think about the highway system. The roads that you use more, they develop more, they get wider, and it becomes a freeway and a multi-lane freeway. Similarly, neurologically, the habits we engage in can quite early on model how our brain develops over time. And substance use does significantly interfere with the development and can have long-term cognitive and behavioral consequences. And finally, in terms of warning signs, what do we look for when we are worried that a child is experimenting or has gone beyond experimenting and now they have a problem use? One of the first things that we often notice is changes in behavior, grades, friendship groups, specifically appearances, and changes in interests. So when I talk about these changes, these are not like things that happen slowly over time, especially when kids enter middle school and high school. They're also learning about who they are in terms of their identity, and that identity piece solidifies. But we're thinking of a rapid change that happens quite quickly over a period of time. And in terms of grades, again, you see a sharp decline in grades, and that doesn't have to do anything related to the academic demands, but rather something else, if you're worried that something else is going on. Additionally, if you're finding drug paraphernalia and unexplained expenses and secretive behavior, these might also be red flags. This becomes more challenging in this day and age because one of the concerns that we have now is a lot of adults don't really know what the tools that kids use to use substances even look like, and they're changing, they're advancing, and a lot of parents often don't know what to look for. So educating ourselves around those issues can be particularly helpful.
Thank you.
Eric, do you want to cover the data, or do you want me to cover the data?
I can share about it. So, so a lot of what we do. So, for example, on our prevention side, particularly within the DC Department of Behavioral Health, on the prevention side, our primary focus is preventing and delaying what we refer to as the onset of alcohol, tobacco, and other drug use. And so, in order to do that, we look at national data as well as local data, which gives us an idea of where young people, where access is sort of the access as well as initiation is beginning for young people. And so this data that we have here is from the Youth Risk Behavior Survey data that's conducted by the Office of the State Superintendent of Education, so OSSE, about every 2 years or so. And so we're really looking at this onset of drug use, particularly marijuana use and alcohol use for middle school students and then high school students. And then for my team and I, that helps us to identify and help us to really look at and to see where we want to target. So we're looking at, for example, middle school students, at the age of onset for alcohol and marijuana use is about 10 or 11. When we come up with content, when we come up with messaging, when we identify programming that may be impactful, we want to make sure that we're identifying things that are age appropriate. And then the same for high school students. So we're looking at around 12 or 13. Similarly, we want to make sure that we have content and messaging and graphics that resonate with these young people as we're looking at sort of, once again, preventing and delaying the onset of that. So this is kind of just one simple example of how we use quantitative data to guide the efforts that we're implementing within the District of Columbia.
Thank you. So now we have some data and some understanding of what substance use could look like at different stages in one's life. Let's talk a little bit more about who to be concerned about and when to be concerned. So for this, we'll have Dr. Kelly Murphy talk to us.
So, like I mentioned before, substance use is on a spectrum, right? A lot of adults use substances without problems. And what we think about always is that it is on a continuum. It starts off with people, and there's no use, and then it goes all the way to problematic use, as you can see on the screen. And there's like, when we think about prevention, we often want to focus on no use. If we have a kid who's not using any substances at all, how do we keep them there? And then when we have kids who are try experimenting, what do we think about their risk factors, and how do we think about preventing their progression from experimental use to social or recreational use? And as you can see from each stage, the goal is always, how do we prevent progression either from social or recreational use to regular use, or from regular use to problematic use? So understanding the risk factors that put someone at risk for initiating and progressing along the spectrum is very important. And it's also, this comes down to, how do we think about decision making? So when a child is faced with a decision about whether they use any substances or not, how do we think about what happens both in terms of their behavior and also neurobiologically that leads to them making those decisions? And next slide, please. So I just want to simplify this and think about decisions on neurobiology and the concept of choice, because we often think about substance use from the perspective of choice. Someone chooses to engage in the behavior. But what determines the decisions we make when we are faced with this situation? We often think about, I want people to think about predisposing factors. What that means is what has happened in someone's life so far that puts them at a higher risk for choosing to use a substance. And then think about precipitating factors, or what's happening in that moment that leads to them trying to use a substance or progressing along that spectrum. And finally, you have someone who has chosen to start using a substance and they continue to use that substance. What perpetuates that behavior? So when we think of, like, in a very simple manner, any kind of decision we make, it's always a balance between the executive function and the limbic system. The executive function, or like the prefrontal cortex, is the front part of the brain that really tells us to think things through, stop, think about the long-term consequences. The limbic system is the more primitive system, which is more about immediate gratification. So it kind of prevents you from thinking about long-term consequences and focus on that immediate effects that whatever the substance might offer, or any other choice that we face in life. Now, we know that kids, given that their brains are still developing, that executive function piece, the prefrontal cortex, that part of the brain has not fully developed yet. And so there is an imbalance. So they're more prone, especially in adolescence, to kind of seek out things that provide immediate gratifications. Apart from the developmental age of being in adolescence, there's a lot of different factors that go into effect when we think about how this imbalance occurs. Some of this could be family history, some of it could be mental health concerns, some of it could be access in the community, etc. Next slide, please. So what are these risk factors that also, leads to that imbalance? So peer pressure is high up there, but the highest one is probably family history. Genetic factors and exposure to substance use within the family contributes to the highest risk of a child developing a substance use disorder. Parental influence and behavior, what they see in terms of their parents' use. Kids tend to idolize parents, especially when they're young. Not so much when they're adolescents or teenagers, but how do parents' behavior around substances influence the child's behavior? Poor parental supervision or lack of parental involvement in life is a risk factor. Emotional and mental health issues. Accessibility to a substance itself, they tend to use, when you think of ease of access, they tend to use things that are more readily accessible. Then there's a sensation-seeking behavior that is age-appropriate. Trauma and adverse childhood experiences. Academic problems, struggling academically or having a lack of engagement in school can often lead to low self-esteem, which is a big risk factor for substance initiation and continued problems. And finally, community and cultural factors within the community and culture, such as availability, normalization of substance use, things we might see in the media, in music industry, for example. All these exposure can influence children and adolescents to initiate substance use. Next slide, please. So we spoke about risk factors, but what are some protective factors? Despite this imbalance between how the brain works, there are still a lot of reasons that kids don't use substances or progress beyond experimental use. This often comes around strong social support, positive relationship with parents, building healthy coping skills, and access to education and resources. Another thing I didn't mention here is if there is a mental health condition, treating that mental health condition can be a huge protective factor. Next slide, please.
Thank you so much for that information. Dr. Kelly Murphy. In the chat, I entered a link to a form that families and caregivers can use to refer their children to the DCPS mental health team if they feel that their child needs additional mental health supports. All right, so let's move on to the next part of this presentation, which talks about supports and treatments. What do they look like? What is available? And so for this section, we'll get started with Eric Chapman.
That was good. Thank you so much. And also I dropped a link to our, maybe it's not a link. I'll put the link to our drugforyouDC.com website. If you look at local resources, a lot of what I'll talk about today is actually listed there. So as we mentioned, so our goal is to prevent and or delay the onset of alcohol, tobacco, and other drug use. And so studies show that the later in which a person begins to engage in drug use, the shorter their trajectory, the shorter the amount of time. Whereas the opposite is also true, where the earlier that a person starts, the longer their trajectory of engaging in drug use. And so we're really focused on how do we educate residents about that, how we educate young people about that. And I'm saying equally important, how do we provide alternatives to engaging in drug use? And so just based on information that we receive and conversations that we have with young people, this is driving a lot of what we do. And so this is a few sort of approaches that we take. One which is the utilization of a 5-step data-driven planning piece, which is the strategic prevention framework. It's a 5-step process where we, based on the issue, we look at or we assess what the issue is. We look at our capacity for addressing that issue. We develop a plan, we implement that plan, and then we evaluate whether or not that plan works. And so we primarily do that through our 4 DC prevention centers. And so they develop youth prevention networks. They have what we call a DC youth prevention leadership course. So there's localized groups of young people that they're working with to really kind of promote them and really help empower them to be ambassadors, if you will, among their peers for the prevention of drug use. So we have this information here. Next slide, please. And so these are our 4 prevention centers. And so we have a total of 4. So it's 1 for every 2 wards. So wards 1 and 2, 3 and 4, 5 and 6, and 7 and 8. That information is here. It's also on our website as well. And this is the contact information for those various companies. For our wards 1 and 2 prevention center, the parent company is Latin American Youth Center. The parent company for our wards 3 and 4 DC Prevention Center is a National Capital Coalition to Prevent Underage Drinking. The parent company for our wards 5 and 6 Prevention Center is Sasha Bruce. And the parent company for our wards 7 and 8 DC Prevention Center is Bridging Resources in Communities. Next slide, please. And similarly, we also have treatment partners that we work with. And so we, through a grant, the DC City grant, we have a focus on young people between the ages of 12 to 25. And so we're looking at adolescents, which we identify as about 12 to 18, and then, or 12 to 17 rather than transition age youth, which we identify as those 18 to 25. And we also provide services for their family and caregivers. And so we really want to utilize this particular partnership to be a one door, if you will. And so if there's a young person who's in need of support, and they also have family members who are in need of support as well, we want to create opportunities for those family members to be screened and also learn about the resources that might be available for their young people and also for themselves. We're focusing on enhancing and expanding the array of SUD treatment services that are available for young people. We're also providing tobacco and vaping cessation and counseling. We want to increase access for those who are in need of not just substance use treatment programs, but also mental health supports as well. And so within the Department of Behavioral Health, and particularly where we sit, we are able to identify partners who can provide those resources and services as well. And so the partners that we have, our our treatment providers are what we refer to as ASTEP providers, which is Adolescent Substance Use Treatment Expansion Program providers. And we have 2, one which is Latin American Youth Center, and the other one which is Hillcrest Children and Family Services. And their information should be on our next slide, but can also be found on that local resource link as well. Next slide, please. All right, and so once again, as we mentioned, so these are ASTEP providers. They do provide drug treatment services. Typically what will happen is an entity, an agency, a family, or it could even be a self-referral is made to one of these groups. And then they follow up by conducting an intake for that young person. And so what's done is an assessment to determine whether or not there is a need, and if so, that level of need. There's also available recovery support services. And like recovery support services, because they aren't necessarily linear from the standpoint of going from treatment to recovery, but it's sort of cyclical, if you will. So a person, they may need treatment and not be ready to go into treatment, but be able to take care of, be able to take advantage rather of recovery support service, which be inclusive of just a mentor, some kind of counseling, support with getting back into school. And so if you know of a young person who could benefit from these services, but you're not quite sure where they may fall on the spectrum, please feel free to reach out to one of these providers. Once again, Latin American Youth Center and or Hillcrest Children and Family Center. And once again, their information is here. Next slide. Okay.
Excellent. So we're going to take a pause right here because we just shared a lot of information. So families, just take a moment to process. A couple of reminders. We have interpretation in Spanish, and that is in the chat, how to follow the steps. I'll make that announcement in Spanish once again. Familias, bienvenidos. Nosotros tenemos interpretación en español. So, los pasos los pusimos en el chat. Lo voy a volver a poner después que empecemos otra vez. For all families, please send us your questions using the Q&A feature. We will try our best to have our experts here answer those questions live. If you are using a computer, you'll be able to see the Q&A icon on the bottom of your screen. If you are using a cell phone or a tablet, you'll need to press the 3 little buttons, and then they'll give you an option to select Q&A, and that's how you can submit your questions to our experts. All right. So we talked a lot about what substance use looks like at different ages, the spectrum of who and when to be concerned about, and we talked about treatments and supports. Now, let's talk about how we actually have conversations about substance use with our children. And for this section, I'll kick it off to Dr. Kelly Murphy.
Thank you. I wanted to draw attention to the app that you see in the slide here. You can get it by scanning the QR code. I think that is something concrete that you can take with you. This app was developed by SAMHSA, which is the Substance Abuse and Mental Health Services Administration. And I really like this app because it gives you concrete ways in which you can start a conversation. It gives you examples of like how to have the conversation, and also gives you ideas. Sometimes kids don't want to have this conversation, and how do you navigate that challenge? And please do download this app and explore it and go through the ideas. I've found it to be quite helpful. Now, when we want to talk to our kids about substance use, you're going to hear me say this again and again. I think communication, specifically open communication, is the key. And this is challenging because as parents, we deeply care about the safety of our kids and the harms from substance use. So our immediate reaction when we find out something's happening in school or with the kids is very reactionary and filled with emotions. You really want to be having this conversation at a time when you know that you're a bit more calmer and you can have that conversation without getting too emotional. And it's important to start talking quite early about the risk of substance use. And it's also important to maintain an ongoing dialogue. Substances are going to evolve over the course of your child's childhood. And, we have to learn and adapt, and at the same time, continue having those conversations. And this is key here, modeling responsible behavior. Do as I say, not as I do doesn't work. Kids learn from our behaviors more than anything else. And the reason I bring that up is it's challenging to have, when we talk about substances, they're talking about a wide range of things from nicotine to alcohol and prescription medications. Now, it is very different in the cultural context. It can be different based on ethnicity, country of origin. But at the end of the day, modeling responsible behavior around it is going to be key. Knowing your child's friends and activities, creating a supportive and understanding environment can be protective factors. I've often had parents ask me about what do you do when they're hanging out with their friends and the friend is using substances. The challenge is also, I often talk to parents about creating their own parent peer group where all the parents have the same expectations. They're consistent in terms of what rules and rules they're setting forth for their kids. And the other key piece of communication is finding out what the kids already know and asking them about letting them ask questions and concerns. And it's essential to listen to them without again reacting, judging, or punishing. In the event that if you believe your child is using substances, it's essential to get them help as soon as possible. This could be through your primary care pediatrician, if you already have a mental health therapist involved, or addiction specialists who can provide guidance on the best course of action. Next slide, please. So the challenge with addiction, and the reason prevention is so important, is because addiction, by definition, is a chronic illness, right? This is often something that once you meet criteria, unfortunately, you're going to have a very long journey with it. And relapse can happen, and we always plan around it. The goal is safety. And we want to make sure we're continuing to support in an appropriate way and seeking help for the child. And like I mentioned before, staying informed for parents is very important. Over the last 5 to 6 years, substances have dramatically changed, and staying informed about the latest trends and being aware of what substances are in your community. By coming to talks like this and other community events, you're learning more and you're helping keep your kids safe. And finally, equip your child with knowledge. Accuracy over hype, as I like to call it. We want to provide accurate information about the risks and effects of substances. And we know that kids, when they have the right information, they're more likely to make better decisions. And it's crucial for parents to be proactive, supportive, and educated when it comes to pediatric substances. And the more informed and involved parents are, the better they can support their children in making healthy decisions. Next slide, please.
Excellent.
I think that's
Thank you.
Thanks.
Yeah, thank you so much for that information. So we covered a lot. So
Can
now
I
let's
just add
take a
something to that as
moment.
well?
Oh, yes, of course, Eric.
Sorry, sure. Yeah, so I mean, that information is great, but certainly just wanted to just echo and just kind of posit that, just having, open and honest conversation with young people. I mean, in even, I guess, since my time and sort of being involved in this work over the past decade or so, really sort of seeing a pendulum shift with regard to young people being more open and more aware, and just really asking honest questions about, what's the impact of this, or why is it okay for you to do X, Y, and Z as an adult, but it's not okay for me. And so engaging in those conversations with young people in sort of reducing or kind of removing the stigma, but just having an open, honest conversation. And I think there's a fine line between sort of condoning and condemning. And so really that fine line in the middle is really just having an open and honest conversation. So when we've had focus groups with young people, some of the feedback that we've gotten is that, well, why is it okay for an adult to do it, but it's not okay for me? I'm dealing with the same stresses, or and particularly around the legalization of marijuana use for recreational use. And so just want to encourage you all to have the conversation. Young people are super duper smart. They're seeing the same information that we're seeing with regard to kind of studies and some of the discussions around the different uses of drugs. And so just certainly want to encourage folks to have conversation with young people about that. And at the same time, to not necessarily be alarmed because your young people are aware of drugs, right? They may just know that these drugs exist, right? And so being able to engage in those conversations and keeping that line of communication open, I think would be extremely helpful in just really being sort of a sounding pad, if you will, for young people. The young people, whether it's your child and or someone else who's really looking to just have an honest and conversation around that, looking for some guidance. So I did just kind of want to share that as well, if I could. Thank you.
Thank you so much. Okay, we're gonna jump into questions and answers. Again, I want to highlight that we have interpretation in Spanish. Tenemos interpretación en español. Por favor, accesen eso si están recién entrando. As far as questions and answers, we're going to go through first a couple of questions that came in the pre-registration, and then we will go to the questions that are coming in via the Q&A. So families, please continue entering your questions that way. All right, so let's get started with this. The first question is going to be for Dr. Kaliamurthy. The question is, what is the most appropriate way to explain to my elementary age children what drugs are and how to avoid them?
That's a great question. So, I think I've been talking about developmentally appropriate language, and the first place to start here would be, I would be keen to know, what does the kid already know, and what do they already see? What are they aware of? The reason I bring this up is because, kids as early as age 8 have favorable opinions of alcohol because it's something that they associate with fun because that's what they see in their households. So we talk about, at that specific age, you don't have to talk about all different kinds of drugs. You start off with what the kids might have already seen in the community, in the family, or something else that they might have been exposed to, and talk about how substances may be things that adults may use for various different reasons. And the challenge is, how to avoid them. It's a question in terms of elementary age kids. We kind of want to focus on the value system. We want to think about what are the family's values around substances, and then provide them with, I would say for elementary age schools, we don't want to focus too much on hard skill sets in terms of peer pressure just yet, but we want to focus on things like awareness, risks, values that the family has and the adults in the families have around substances. And then those things automatically inform them that substances and drugs are some things they should be avoiding for as long as possible. And, and you want to, again, encourage questions, even however young they are. Always go back and see if they have more questions about this topic.
Thank you. The next question that we have is, I'll send this one to Eric Chapman. How can I motivate my middle schooler to stay away from drugs given all the peer pressure at this age?
So once again, and I think Dr. Kalamurthy sort of mentioned as well, but just being observant, kind of understanding who they are engaging with and engaging with the young people, right? Having those open lines of conversation. And I think also as much as possible, kind of looking for things to keep them engaged. And so we know for some young people, they're bored, or maybe other people are doing X, Y, and Z, but if they kind of see sort of the impact of their decisions right now, right? So if I'm using drugs and trying to play sports, then I see the impact of that, right? If I'm trying to focus on this particular program, this particular activity, but I'm engaging in drugs, and how does this impact these other things that I'm more sort of committed to? So I think being able to have those conversations, being vigilant, being observant, communicating with young people, and showing that there are those clear lines of communication, or the very least open lines of communication, I think will be helpful in being able to motivate middle school students to stay away from drugs. And just, once again, just kind of having those conversations, understand where they're coming from. If the subject comes up, being cautious in how you respond, so that you aren't responding to sort of alarm way, or way in which we're sort of shut them down from sharing information more freely.
Okay, excellent. Let's do, I see a few coming in from the live Q&A. So let me go to one of those, and then we'll come back to the ones that we had here. The first question that we have in the Q&A is for, let's send this one to Eric, since we have you on. Parents may worry about any punitive consequences for them if they raise concerns about the child's substance use. Can you address that?
Yep, great question. So certainly if you are making a referral to a provider, so to one of our ASTEP or one of the treatment providers, they are assessing the young person. So it's not necessarily like a call to CFSA where they are then sort of swooping in. And so please, if you notice that your young person maybe seems kind of weird, maybe they seem high, maybe they smell like weed. And so if you aren't certain, you certainly can have a conversation with them, and then make a referral, and just sort of encourage them to, at the very least, engage in conversations with one of the providers, and they can sort of take it from there, if you will. The providers don't have the ability to make your child do something, but they also are not necessarily in the business of coming into your house, kind of looking around. Naturally, if there are some, there are mandated reporters. So if there's kind of something going on that, maybe a little more obvious, then, that may be something that they may make note of, and it may be some kind of intervention. But, we certainly, just through our efforts, as I mentioned, the referrals, can go directly to the providers. If your young person is engaging in drug use, and if they're open to having a conversation, they're open to getting some help, you surely can make that referral. Other providers can follow up with them, and you can sort of coordinate that. And so there's definitely a more direct way that doesn't necessarily require having to go through the school or having to go through CFSA or MPD to make that referral, if you will.
Mm-hmm. And Eric, a quick follow-up on that.
Yep.
So we talked about those like potential, like what it looks like from the parent side. Can we talk a little bit about like the student side? Students are being suspended for marijuana use at school, but this is like a mental health component that can be addressed. How are like school-based DBH clinicians being engaged in this efforts?
Yeah, so there is a multifaceted approach, right? So you have, certainly you have DCPS on sort of one end, you have DBH's, school-based clinicians on another end, you have my team and I and the drug folks, if you will. And so really, I mean, the sweet spot is when the school recognizes that they can benefit from these types of services, and you have a clinician who sort of tap into certainly kind of whatever the school is in need of, and then whatever the sources that are available. So we have a number of school-based clinicians who are offering the Too Good for Drugs curriculum. We actually got, literally just boxes of additional curricula in last week. And so the Too Good for Drugs curriculum is something that can be used within health classes or whatever sort of setting that the clinicians are able to use it in. And it creates the opportunity to have conversations with young people and then really adults within the school around substance use, which then hopefully will sort of foster that relationship so that young people, if they are in need, they can then follow those school-based clinicians. We're in regular communication with the clinicians and at the very least their supervisors. And so we, make that information available to them if they need us, or the clinicians need us and or our prevention centers to come in and talk more about substance use, particularly prevention and or treatment and recovery. We're typically tapped in for that as well.
Thank you. And families, again, I just want to flag another resource that we have in the chat. Might take me a second, but if you have any concerns about your child's mental health and you're looking for resources and supports, we have a DCPS form, DCPS referral form. While I get that in the chat, I want to send the next question to Dr. Kelly Murphy. What are the signs that a child is using drugs? How would a parent figure it out? Like what to look for?
So I just wanted to touch on a point about the previous two questions about how do parents have conversations with the elementary school and middle school kid first. I just wanted to emphasize that the parent-child relationship is going to be key here in terms of any conversation that you're going to have around substance use, right? So really focusing on how do we continue building up on that relationship in a developmentally appropriate manner before we even think about having these conversations. And this develops over time. So I just wanted to emphasize on that. So coming back to this question that we have now, what are signs that a kid is doing drugs? Things have changed dramatically. Like in the past, we would see smoke, we would see smells, with the kind of cannabis products, the nicotine products kids are using these days. It's really hard to find signs of odd smells coming out, maybe a fruity odor here and there. So I think it's just being very observant, like Eric mentioned, from a parent's perspective. And in terms of, you may not see signs of the typical marijuana smell in some occasions or the cigarette smell, but you may be noticing other things. So we the first few slides I spoke about, like a sudden decline in grades and making new friends, neglecting responsibilities, isolating themselves. But other things that we're noticing now specifically is weight loss seems to be big. A lot of kids are losing weight. Your pediatrician might pick up on it quite early on. And then there's also like other unexplained illnesses. Some of these withdrawal symptoms often present with flu-like symptoms that we need to be mindful of. And it is challenging because, right, after everything we went through with COVID and all the other respiratory illnesses, we want to rule all that out first. But, if it's happening quite episodically and frequently, we also want to kind of be aware that maybe they're withdrawing from a substance, and that's what's leading to these symptoms. Frequent lying, unexplained, expenditures and spending money. Those are some other common signs that, there may be a chance that your child is using substances. So, I mean, like, being observant and sometimes, just go through the kid's backpack occasionally to see what you find there. That might also be helpful.
Thank you. A quick follow-up to that question, but I'll kick it off to well, either of you. I don't know if Eric, you also might want to chime in on this one. What are information and like resources out there for families to use that are available in either like Children's National website or DBH? Families who really want to have information about like talking points to talk about their children about substances, any programs for youth that could help create positive examples of what it means to be substance free.
Yep. So I think what Dr. Siver reported earlier, definitely the Talk They Hear You campaign is a great example. At the very least, sort of just encouraging adults and parents to have those conversations with young people. A lot of the data that we get, I mean, we may feel as if we're kind of talking to our young people, they don't care, but I mean, really that parental approval and what parents think really outweigh in more cases, even what peers think. And so just being willing to engage in those conversations, have conversations about, what a young person is watching. One of the questions was around not necessarily peer influences, but sort of media influence, right? So what are they watching? What are they listening to? And I just sort of responded in the chat. I mean, I think that creates the opportunity to have conversations with young people that's less about what are you doing, right? But more so, hey, well, what do you think about, smoking weed, or so-and-so is rapping about X, Y, and Z? What do you think about it? Do you think that's okay? Or, and I think those opportunities to really sort of broach conversations that aren't necessarily brought up by you, right? And it's less about, it's less personalized. So it's less about, hey, little Johnny, what are you doing? And or what are your friends doing? And so I think that kind of, once again, being able to engage those conversations, so the Talk They Hear You is a good piece. The Drug Free Youth BC website is where we try to have information where, this kind of talking points that you sort of bring up with the young people. If you're kind of looking for information, sort of looking for data points, and, we have those resources there as well that will enable folks to have conversations.
Thank you. Two quick follow-ups on that. The first one is thank you so much for your answer. What programs are out there, like in DC, like across the city, that that families can access for their students who want to be a positive example of being substance free?
Sorry, I was trying to look at the chat and respond to my mind. And so that was the second part. You did ask that initially. What was that part? What was it again? Kind of
Yeah. No, you're good. I read it and then I heard myself. Let me go again. Are there any programs for youth that want to be positive examples of what it means to be substance free?
Yeah. So we so through some of the work that we engage with. So once again, our prevention centers, I mentioned rather that they have the Youth Prevention Leadership Corps. And these, once again, are just kind of, we want to identify, cool people, right? So young people who are engaging in sort of positive activities and really looking to be ambassadors for engaging in and sort of ambassadors for the prevention of engaging in drug use. I think the other piece as well, this is something that when we first started becoming a little more interwoven with our school-based clinicians, and so we had we had some data which was around sort of kind of have you ever sort of thing, right? And so just the percentage of, and this was self-reported data. This was a survey, a telephonic survey that we did. And I remember one of the dads looking at the data, and I think it was like only 25% of the young people who responded said that they had ever done X, Y, and Z, right? And so for him, it was, well, no, the majority of the people are not engaging in drug use. And we still see that today, right? And so young people may not believe it because the people in their sphere may be using drugs, or they may see them, or they may assume they're using drugs. But I mean, I think just a data point alone is the fact that not everybody's engaging in it, right? And so I think being equipped with that kind of data helps young people to identify the fact that not everyone's doing drugs, right? And so I think if they know that, then it's kind of, I mean, it's sort of reverse peer pressure, if you will. Certainly we can look at, once again, positive opportunities, positive groups that are going on. One of the things that my team and I are working on, we're getting ready to do we're doing a refreshing and rebranding of all of our social marketing campaigns. And instead of focusing on don't do drugs, you're going to die, we're really looking at what are those positive alternatives that young people can engage in. And so we're looking at different groups and different positive sort of peer groups around the District of Columbia that young people can tap into. So we're looking at the Eastern High School Marching Band. We're looking at the Dunbar Bike Club. We're looking at the Anacostia. They have like a boat group. And so these are things that we want to highlight. We want to highlight these positive groups, these young people that are doing great things that are really an alternative to engaging in drug use. My community engagement team manager has been working with his team, and we've been doing a number of wellness events. And these are events where we have folks coming out doing artistic expression. They're doing hip hop yoga. So we had one last week at Deanwood Recreation Center, and we have one this weekend at Harrison Rec, which I believe is right on V Street in Northwest, in between 13th and 14th Street. And so we'll be having some promotion on WK West about that as well. So really want to encourage folks to come out and take advantage of those opportunities. You'll see other young people who are engaging in activities and engaging in thoughts and behaviors that are sort of that run conflict to engage in drug use. So once again, looking at enhancing those protective factors and not just focusing on those risk factors that are associated with drug use.
Thank you. Thank you for your answer. Dr.
Sorry, I just wanted to chime in. I really liked Eric's response on that, but I wanted to highlight a few key features here. When we look at national data, we do know that substance use has, for most substances, it's on the decline or has stayed the same. We're not seeing a big increase in substance use overall. And when we talk about substances, you're including alcohol and substances and legal and illegal substances. The challenge here is that we want to be careful about not vilifying a substance to or take it to an extreme in terms of vilifying a substance, because a lot of these kids grow up to become adults, and we want, if they engage in like the legal substance after age 21, we want them to be able to engage in it in a healthy manner. And if they do get into trouble, right, we want them, to be able to get help without stigmatizing it or associating shame that they've gotten into trouble around substances. So I wanted to highlight that. And the other thing is also when we look at the kids who do get into, who struggle with substance use disorders, there's a lot of shared vulnerability. A lot of them come from disadvantaged communities. A lot of them have experienced trauma, and they come from, families that are broken up, or parents are unable to offer good supervision due to their own economic situation, etc. So it's often when we want to, promote kids who don't use substances, right? Like that might be a privilege for many of the kids who don't use substances, right? We want to think about who are those kids coming from that affected communities who then have been able to utilize the community resources to successfully stay away from using substances. So we want to be particular about who we highlight as being successful in abstaining from substance use in childhood as well.
Thank you. All right, so we have a few minutes left, but I want to make sure I ask one question and then we'll do the most impactful action. Okay. I'm going to combine two questions, one that came in through the live Q&A and one that came in the pre-registration, because I think both get at the same theme of family action. The question that came in through the live Q&A is, where can you get help with your child if needed? So that's the first one. And the second part to that question is, what can a parent do immediately after we've noticed an overdose until medical help arrives? Dr. Kelly Murphy, since I had you up, if you could continue, and then Eric.
So, you know, so once you know, I mean, the challenge is often like, how do we even identify an overdose, right? So you suspect that someone has used a substance and that they're unconscious, not responsive, their breathing has slowed down, etc. So the immediate response, you know, we want to do is, if you do have naloxone, brand name Narcan, as it's widely known available, you start administering that and start giving first aid while you're simultaneously calling 911. And like in terms of first aid, you might not have to do you know, complete CPR, like you're not doing chest compressions. There's more focus on making sure that you're giving you know, respiratory aid, making sure the airway is open. And also, if you do call 911, you know, they are probably giving you advice on how, you know, what to do at that time. So keep your phone line open and continue listening to their direction.
Thank you. Eric?
Yeah, I would just echo, I mean, certainly having, if you suspect that your young person is engaging in drug use, particularly opioids, and having access to Narcan, naloxone. I mean, you know, my kids are like 4 and 7, but I mean, I keep some in the glove box just in case. And so certainly, I mean, that's one way of doing it. I'm not a medical professional, so I can't tell you exactly what would work, other than, you know, if you have access to naloxone. So certainly, as soon as you notice it, calling for help. But that, you know, certainly, if you have a young person or family members who you believe are engaging in opioid use, have the potential of doing so, just having access to naloxone and Narcan on hand is what I would recommend.
Quick follow-up, where can families get access to those in the city?
Yeah, so I know the Department of Health has some, and then DBH through our the district opioid response team, they do trainings for naloxone, in which people can get it afterwards. I'm not sure, and I can drop my email address in the chat if somebody wants to follow up, and I certainly can look at it and see how to get them connected.
Mm-hmm.
And Demelza, just flagging too that naloxone is now available in our schools as well for use by trained staff.
Thank you, Natalie. All right, so thank you so much for that information. We're going to move to most high impact action that families can take, because we covered a lot of information. But before we do that, before I get your final response to that, to our guests, I want to make sure that their families, if you're still on the call, thank you so much. We have a poll that's going to go up. We want to know who was present in the session. We want to know like the age of your child, so we can continue improving the sessions and tailoring this information for you, and then how useful this information was. Also in the chat, I'm entering the link to the app that Dr. Kelly Murphy mentioned, that to give you prompts and like help you like have conversations with your children about substance use. So that's also in the chat now. While you do that, families, if we could have some closing remarks from Eric and Dr. Kelly Murphy on the most high impact actions families can take. We covered a lot, but if a family is walking away from this conversation, what is the one thing that they can do to support their children and to have those conversations with their children? So let's get started with Eric, since I see you're unmuted.
engage your young people. Don't be afraid to have conversations. Look for opportunities to engage with them. You know, if you're kind of seeing something, look for opportunities to just bring up things that you may see, right? It doesn't, once again, doesn't necessarily have to be accusatory, doesn't necessarily have to be about them. But the earlier that you see them either at risk or potentially engaging in certain activities, I would say the better in terms of, you know, really being able to have an impact. Let them know that you care. Keeping those channels and lines of communication open so that if they do find themselves open to experimenting or kind of being pressured to or thinking about it, that they have somewhere where they can come. And I would also add that, you know, for young people, and once again, we sort of, I keep mentioning sort of data that we've collected in focus groups because we really try to ensure that we're doing data and having data-driven approaches. We're just being available for young people. I think a lot of young people that we've talked to most recently are kind of dealing with a lot of stressors. I think Dr. Silva sort of mentioned, you know, sort of kind of coming out of this pandemic piece. So young people are talking about being depressed, lonely, stressed out, having a weight of the world on their shoulders, and then sort of engaging in drug use is sort of one way in which they are figuring out how to deal with that. And so, I mean, having conversations and being open and available for young people, I think is the highest impact that you can have, and ensuring that they know that there is a caring adult that they can engage with rather than have a conversation with when they feel themselves thinking about engaging in drug use.
Thank you. And Dr. Killian-Murphy?
I agree with everything Eric shared. I think engagement is key. And I also want to talk about engagement at a community level because, you know, you're not alone as parents, and this problem is not unique to any individual family. This is something that you're seeing at a community level. So kind of engaging, like coming today, like having conversations with us, like conversations among yourselves, how you can support each other in the community. And I also wanted to emphasize role modeling. I think I spoke about that a little bit. That's it, you know, how do we might not be paying a lot of attention to how we act with substances in the presence of kids, but maybe being more conscious of that as adults. Reinforcing personal and family values. Think of what are the values in your family? Is that a conversation you've had with your spouse and your general family members on what you want to pass on to the next generation about your relationship with alcohol and other drugs? And again, share resources. You know, one of the things that I noticed when kids started coming into my clinic for treatment, I saw that when the first kid came in through that patient, the family knew about a few other kids who needed help and they started coming in. So you never know who's going to need it. So share the resources, talk about conversations that, you know, you're having with school, some of the things that we spoke about today, be willing to share that with other members of the community.
Excellent. Thank you so much for that. And thank you so much for being with us, both of you. We really appreciate all the expertise and experience that you bring. Families, thank you so much for being with us today. Thank you for your feedback. We can only improve our work with your feedback via the surveys. I am putting in the chat the links to the recordings that were DCPS specific information from central office teams, central services teams that support schools. The recording for this session will be up in the next couple of days, and it will be available in English and in Spanish. And so you'll see that in our social media channels, as well as our YouTube, DCPS YouTube page. But again, if you have any further questions, if you are looking for resources, you can always get a hold of us via social media. Those are our platforms right there, or via email at parentu@k12.dc.gov. Again, thank you so much, Eric, for being here. Thank you so much, Dr. Killian-Murphy, for being here and for all this information. And most of all, thank you, families. Have a great night. Thanks.